My name is Nicola Lalam, and I'm going to talk about disorders of fluids and electrolytes, electrolyte and acid-base disturbances in patients with diabetes mellitus. Definition. The prevalence of diabetes is increasing rapidly, and type 2 diabetes now accounts for 20 to 50% of cases of new-onset diabetes in young people. Electrolyte disturbances are common in patients with diabetes and may be the result of an altered distribution and electrolytes related to hyperglycemia-induced osmotic fluid shifts, or of total body deficits brought about by osmotic diuresis. Complications from an organ injury and the therapies used in the management of diabetes may also contribute to electrolyte disturbances. Applications in medicine. Without enough insulin, your body begins to break down fat as an alternative fuel. This process produces buildup of toxic acids in the bloodstream called ketones, eventually leading to diabetic ketoacidosis if untreated. Sodium. Elevations in glucose concentration increases plasma tonicity, creating an osmotic driving force that favors the movement of water from the intracellular space to the extracellular space, thereby diluting the extracellular concentration of sodium. Potassium. Insulin deficiency, which is more common in type 1 diabetes than in type 2, is an important factor in the net efflux of potassium from the cell. Acid-base disturbances. Ketoacidosis results when the rate at which hepatic ketoacid is generated exceeds peripheral utilization and the concentration of ketoacid in the blood increases. Pros and cons. Pros. The treatment of diabetic ketoacidosis involves the administration of insulin and intravenous fluids to correct volume depletion. The primary goal of therapy of hyperkalemia acidosis suprarenal is to correct the hyperkalemia. In many instances, reducing the plasma potassium concentrations will correct the acidosis. Cons. Hyperkalemia is frequently present on admission in patients that have diabetic ketoacidosis, even though total body potassium levels are reduced. Issue applied in Ecuador. Diabetes mellitus is a non-transmissible chronic disease with a high prevalence worldwide. In Ecuador, this illness is one of the main causes of mortality, and it is related to many diseases that are produced as a consequence or a degeneration from diabetes mellitus 2 due to age and also because of bad management of the disease by the affected person and relatives. Conclusion. In summary, the dysregulation of glucose homeostasis leads to many direct and indirect effects on electrolyte and acid-base balance. Since the high prevalence of diabetes ensures that clinicians in virtually every medical specialty will interact with this patient, familiarity with related electrolyte abnormalities is also important. Thank you.